The patient I'll be reviewing today is a 9-year-old male. The history of mood disorder not otherwise specified. The chief complaint is symptoms consistent with ADHD. He's new to our practice. Regard to the symptoms he's been feeling for the last 6 to 7 months, there's been excessive hyperactivity. He blurts out answers in class, forgets to turn in work. He's fidgety, bouncy, in their own words, fidgety, bouncy, makes weird noises at inappropriate times. He's aggressive when playing with friends, not cooperative with daily chores, dishes, laundry, cleaning out the cat litter, etc., along with some mild anxiety. In regard to medication, he's only ever taken melatonin. He's not currently active in therapy and denies any psychiatric hospitalizations. He denies suicidal thoughts and thoughts of harming himself in any other way. Denies trauma history as far as allergies are concerned. No known drug allergies, just some seasonal allergies. No chronic illness. No medical hospitalizations. For social history, he lives with bio parents and 3 older siblings. He's a 4th grader. He has friends at school. He plays football. He enjoys hanging out with his friends and playing video games. In regard to his family history, mom has ADHD and notices a lot of the same symptoms in him that she has. Denies any real violence history, so he's not like fighting in school. He's just kind of aggressive a little bit with his play. For his mental status exam, he's healthy, he's cooperative. Speech is like maybe a little pressured. He speaks very quickly, and don't know that his brain necessarily has time to process what he wants to say before he can get it out. His mood is euthymic, and his affect is congruent with his stated mood. He denies auditory and visual hallucinations. His thought process is linear and goal-directed. His insight is mildly impaired. He doesn't feel like he needs any help, and his judgment is impaired as evidenced by the impulsive behavior that he shows. But in regard to his cognitive abilities, he's met the majority of his milestones. Some of the social stuff is not, maybe not at his age level, but it's like milestones he's met for the most part, and he's currently at his grade level as far as intellectual abilities. As far as our plan goes, we're going to have both parents and teachers complete the Connors Comprehensive Behavioral Scale. This should give us a little more insight into which direction to head with a diagnosis. In the meantime, my preceptor chose to initiate guanfacine 0.5 milligrams at bedtime in hopes that we can decrease at least some of the anxiety and maybe some of the ADHD symptoms too. There wasn't a worry as far as like tanking his blood pressure or anything like that. So yeah, she decided to do that until we get a result on the behavioral scale. We recommend CBT and follow up in 1 month.